work that we plan. Great. We need that.
It's really important. We want to.
Yeah, it was when I started talking. These are just, I wanted to make sure to outline like what are our actual action plans so that you guys can see, you know, this is a 5-year grant. So each year we say, what exactly do we want to do in year 1, year 2, right? In our year 1, we're really looking at in food service guidelines, assessment of the area and building and identifying key partners in the food voucher program. Specifically, we're looking at that assessment again, but we're looking at partnering with Canby's Market, convenience store locations. And so not only assessing what that looks like, but looking at who those key partners could be to make infrastructure change to make that happen. And then in produce prescription, again, we're looking at assessing the area for that. And we'll mention a survey at the end of this that's really trying to get to that assessment piece. And then we're also looking at helping to support technical and infrastructure supports for those programs since they are kind of up and coming and consistently transitioning, it feels like, and there's lots of partners involved. How do we support the infrastructure to make those stronger? And then hopefully that gets us to policy eventually, right? So with that, this is a list of all of our partners that are consistently involved monthly in our nutrition meetings, moving this work forward. But I also would love to recognize there's tons of other partners that maybe aren't on this list that either could be involved or are involved in other capacities too. So I just wanted to recognize this list of the group of people that's been there since the start and really comes monthly to support and push this work forward. So with that, I'm going to pass it over to our first partner, Melissa Cotton, who's with MU Extension, and she's going to talk about the food service guideline strategy area specifically.
Hi, everyone. My name is Melissa Cotton. I am a nutrition and health specialist for the University of Missouri Extension, and I have my colleague Elizabeth here in the crowd and our colleague Sydney. This is our team. We provide research-based education in community settings around the Kansas City area. And so we do a lot of direct education, thinking like strength training, cooking classes, things like that. But we also do a lot of work. I'm sorry, I'm having trouble forwarding the slide. We also do a lot of work in what we're talking about today, trying to make those changes in policy systems and environments. And one of the ways that we're doing that in this collective effort in the REACH grant is through Eat Smart in Parks. So Eat Smart in Parks, and if you grab that QR code, you can look at our full toolkit and kind of what some of those activities look like. But a lot of times when we're thinking about healthy changes, thinking about that individual level of what could I or you do to make ourselves have a healthier life, those strategies are important, but they're not always effective when we don't look at the bigger picture and set people up for success so that all the places they go to eat, learn, pray, play, if those environments aren't giving them options to pursue those healthy goals, then it's kind of hard to be successful, right? So Eat Smart in Parks is doing just that in those areas where we play. So we work with parks and community centers to look at the food items that they sell and help them to kind of level that up if needed. So the way we could level that up is they could adopt a full new policy for the types of foods that they sell in their facility, but they could also do smaller scale changes. So sometimes those healthy items are there. It's just a matter of marketing them better, helping the consumer to understand that those options are available. It could be maybe just adding 1 or 2 more healthy items. It could also look like adding nutrition information to the menu. So one site that I'm working with right now, the only food that they sell on their site is in a vending machine. And so we are just adding the calorie count macronutrients so that consumers can make a more informed decision when they're choosing those food items. So that's kind of the work that we're doing. At the end of the day, just like Robin said earlier, we're trying to make that healthy choice, first of all, an option, right? But also easier to access. So last thing I'll say is this work always works better together. So if you have connections, if you have parks or centers in your communities that you think would be interested, or like Kelsey said, if you'd like to be involved, we would love to have more on our team. So I'd like to now turn it over to my friend Donna Martin from Mid-America Regional Council. She's going to talk about the food voucher program.
Okay, well, thank you. Thanks. That was great. I have a funny story for you later about food labels. So yes, my name is Donna Martin. I am from Mid-America Regional Council, and I am a public health program manager there. And I also, my probably a more descriptive title is I'm the project director for Double Up Food Bucks, and also a program called KC Fresh RX, which is a produce prescription program, which I'll just have, that's a little side note in this discussion. So Double Up Food Bucks, I'm hoping that most of you have heard of Double Up Food Bucks, but if you haven't, I have a bunch of brochures if you are interested in having these to hand out to clients, patients, whoever the folks you work with. But it is a healthy food incentive program specifically for fresh fruits and vegetables. We currently have 164 locations across this, Kansas and Missouri that are providing the program. And those locations are grocery stores, farmers markets, farm stands, and we have 2 mobile markets currently offering the program. And essentially it's for SNAP recipients, and it allows them to access more fresh fruits and vegetables. So when they're buying fresh fruits and vegetables, they get more fresh fruits and vegetables essentially. And I will say that just adding on to Kelsey's point, like I can't do this job at all, this program at all without many partners. And so the way I look at it, it's almost like throwing the pebble into the pond. You know, I'm like the pebble that, you know, or I'm not even the pebble. I'm the first little ring. And then the next ring are all the organizations you see here. So we have Cultivate KC, K-State Research and Extension, West Central Missouri Community Action Agency, the University of Missouri Extension. All of those folks are out there doing the hard work of working with farmers markets and farmers and really capacity building so that we're bringing food that is grown in primarily Kansas and Missouri, a little bit in northern Arkansas, to places, like I mentioned, where people can access it. And then KU Medical Center offers our evaluation for the program. So then of course, the next layer is all those places that offer the program. And then in addition, the layer after that is all of you folks and all of the community partners in every single community that we do this program who are getting the word out, because it is amazingly difficult to get the word out to SNAP people if you happen to have that opportunity. So yes, I can't do this by myself. So our work right now, we're trying to crack the nut of trying to figure out how to do this program effectively at essentially gas stations and convenience stores, small kind of grocery store like places. And it's challenging because they are really different than a grocery store. And we're learning a lot about, we're having conversations with their owners and their POS providers and all that. And they function differently. So we're trying to figure out, okay, how can we do this and still be accountable, still do the program to where I can, pass the data back up to the USDA and say, yes, we did this in a very accountable way. So that's what we're trying to crack the nut in on this. So, and then Canby's Market in a lot of these locations is the organization that is supplying the fresh fruits and vegetables. So they're involved as well, because we're trying to figure out how they're supplying, they're tracking what's being sold, and then how to track those sales and give the Double Up Food Buck incentive. So that's our challenge there. In addition, I think a thing that came up recently is we do actually have one farmers market, Ivanhoe. Well, actually, City Market is like in the universe itself. We should all love City Market. Like it is a treasure for our community, and they do an amazing job at welcoming and serving folks who have SNAP. So I love that. So But we also have 2 grocery stores that I think maybe some of this work will develop in how do we support the KC Sunfresh stores in this zip code area, because those stores are being kind of supported by a community development group. It's not a usual kind of model of running a grocery store, but this community development group did not want those grocery stores to go away. So they're kind of providing the administration for those stores. But honestly, it's hard work. And so, I'm like, how do we support them better? How do we make sure that we're getting this word out so that the SNAP customers know and are encouraged to go shop there rather than going, 20 minutes away to Walmart or someplace else when they have a location right in their neighborhood that they could go shopping at. So that's just a side note. And then, like I said, I do, we have a KC Fresh RX program. I'll just 1-2 sentence about that. It's a much smaller program. It's not across the 2 states. It's only in Kansas City right now. We're in our 2nd cohort. We work with Medicaid patients that are referred to us from 4 clinics right now. Sam Rogers, 2 at KU Medical Center, and 1 in Advent Health. And they're Medicaid patients who are pre-diabetic, diabetic, pre-hypertensive, hypertensive, and we're basically seeing if 6 months worth of incentives given to them on a special gift card that can only be used for fresh fruits and vegetables at the grocery store, at 25 grocery stores in the city, if that is going to help move down move the needle on their A1C and blood pressure levels. We also provide them with a lot of nutrition education along the way. So and we've seen some really, really fabulous results. So fingers crossed that continues. So thank you. I'm going to hand it off to Janet Roan from University of Health. Oh, okay. I did say Janet.
Janet always throws me out to the look. Morning, guys. And I'm still on caffeine, so I'm going to talk really fast. My name is Raquel Garcia, and I'm the Community Health Education Manager for University Health, Truman. And Janet Roan is my colleague and also another manager for Nourishment and Nutrition Department through Community Health. And so our job at Community Health is to take all education outside of the hospital. So everything we do in our department is outside of the hospital walls. And we're in the community. We try and stay in the catchment area, and we are able to do all ages. So although children isn't our thing at Truman University Health, we are able to go into the school. So we do a lot of education, all ages. Pre-pandemic, what we did, University Health at one point wanted to own its own grocery store. When that didn't pan out, we got the bus. With the bus, we went around to those zip codes that were food insecure and sold at cost. That was great. Then pandemic hit. Once pandemic hit, we secured many, many grants and helped deliver thousands of bags and boxes of produce all over the city during COVID. Once COVID was over, so many other food entity programs started popping up. So we realized that we had to focus more on the education side of it. We develop programs from scratch, and we tailor make them per age or per community, per language. So we realized we needed to do more on how is food correlated to chronic disease prevention. So we started developing programs that have education along those lines. So not only how does it correlate to diabetes and hypertension, but how do you need to clean this food? How do you store it safely? We tried to come at it at that angle. So we created Food Pharmacy. That's our new pilot initiative. It's a year-long initiative that we partner with community partners that have community health workers, partners that have trusted community health workers already working with people in the city. So we use the community health workers to go out and implement that year-long binder of education. So every 2 weeks, the community health workers go out, they give a bag of produce along with a recipe and the education, and then they report back to us all their data and how much is being learned throughout the entire year. Right now, we have about 5 different community partners that we're working with. The goal was to get 150 participants by the end of the year. And again, this is our first year, so we're hoping to get to that pretty soon, but we're getting there. Also, at our hospital, which is new within the past year, we have our first pantry ever. It's called One World Pantry. Any inpatient and outpatient clinics assess all of their patients for food insecurity. If they are food insecure, they get a referral to go directly to the pantry after their appointment to get whatever they need before they leave. You do not have to be a University Health patient to be a part of that pantry. And so they are open throughout the week, but it is an awesome addition to the hospital, and it is very well utilized. With the mobile market, we still have the mobile market bus, but we no longer sell produce off of it. But we do still partner with community partners for grant funding to be able to go out and do and provide produce for whatever your organization is working on. Oops, sorry, I went too far. There you go. Dr. Kelsey talked about well, I don't think she actually said the word survey, but we are developing a survey that we would love for all of you to help us fill out. It'll be coming out in a couple of weeks, but that's the only way that we're going to be able to assess how we can be better here in Kansas City to approach this issue. So if you don't get it within 3 weeks max, please reach out to Dr. Kelsey so that you can help us fill out that survey. Thank you.
Great, that was a lot that they're working on in the nutrition component. So thanks for sharing all that. Next up is the third component, last but not least, but that's family healthy weight programming. The director of this component is Dr. Sarah Hampel from Children's Mercy. I think a lot of us know Dr. Hampel. She's actually traveling for a meeting right now. So her colleague and partner in crime, Dr. Helena LaRush, is going to share what they're working on. Come on up, Dr. LaRush.
Yes, I'm not Sarah, but I play her on TV. Our Family Healthy Weight program is, our goal is to increase access to this type of programming. We are working with providing it not only at Children's Mercy, but we are lucky enough to now be partnering with Swope Health to try and provide it there as well. Actually, they're going to provide it with our help. What is a family healthy weight program? It is a comprehensive kind of evidence-based family lifestyle change program, and it's to help children ages 2 to 18 with excess weight. It includes both parents and children, and the idea is for them to work together to make changes that are lifelong to help the entire family. It has good outcomes. It can improve positive parenting and child perception of parenting. It can enhance child psychosocial functioning, improve body image and mood, to build positive peer support and skills to address weight-related stigma. It really can work on, believe it or not, parent mental health and reducing the kind of weight and shape concerns is what we try and do. And increase healthier eating behaviors and nutrition quality in both children and parents, and promote physical fitness, reductions in sedentary behavior. It is a structured curriculum. Ideally, it's 26 contact hours if you get there. And it is delivered by trained professionals. And see if this is going to move.
How many people does it take here?
Okay, apparently that's the only thing work. So there's me, there's Sarah, and then in addition we have Meredith Dreyer Gillette and Sarah Bullard, who does some of our training and working with families at Children's. There we go. So what is our plan? We have been working to assess family and provider needs by examining what happened with our most recent version of the program at Children's Mercy. And we have been lucky enough to establish a partnership with Swope Health. We're collecting feedback from both parents, providers, and clinic staff at SWOPE to try and find how we can best adapt what we are doing at Children's to what will work best at SWOPE, which may not be exactly the same. We are revising our family healthy weight program based on feedback from the last time we ran it and from what we hear from SWOPE. We will be developing methods for connecting families with some of the lovely community projects that are happening that you already heard about in nutrition and physical activity. We want to make sure our families know about those programs and know how to be connected to them. We are developing an implementation plan. We are planning to launch at both locations. We will restart at Children's and we will be launching at SWOPE, we hope, in January. And then our next project, as you know, this is a 5-year project. Our next big thing that we are going to take on is to try and take our project and culturally tailor it and translate it into Spanish. And our partners are SWOPE, the Kansas City Healthy Life locations, and Resource Connections at both clinic locations. And I'm going to turn it over to Priscilla from SWOPE to take it over.
Good morning. It's really an honor to be here, and I'll be quick, but hopefully you guys learn a little bit more about SWOPE Health. So at SWOPE Health, we're a federally qualified healthcare center. We are not for profit, and we are a primary healthcare provider. We serve low-income communities across Kansas City. We are accredited by the Joint Commission, PCMH, HRSA, in multiple levels, and we're really proud of that. We have achieved our accreditation every single year, and we run a lot of new initiatives in the city for our population. We have 8 family care clinics serving Jackson, Cass, Clay, Platte counties, Missouri, Wyandotte, Leavenworth, in Kansas. So we serve in Kansas and Missouri. And the top clinic is our central clinic. It's like a few minutes from down the road. We also have 11 health and dental clinics for pediatric patients and population. And this is over the past 5 years or so, we have grown so much in our pediatric patients. And we also have 7 behavioral health facilities, and we keep growing with all these clinics. There's big plans for the next 5 years as well as for growth on our clinics and expansion. So we have 114,000. It keeps growing. 33% of that is children and their families. So that's kind of like around 15,000 patients, and 20% of our patients are Hispanic, and most of our population, 57%, is Black, African American, 30% is white, 37%. So the total number of services provided last year was pretty good. We had all these services provided: pediatrics, dental care, primary care, behavioral, optometry, dietitian, podiatrist, pharmacy, transportation. And why did we decide to collaborate with Children's Mercy and KC? Is because we have a similar vision for what we want to do in our community, and we have wanted to do this for a long time at SWOPE, and our partners also wanted to do the same thing for quite a while. And then I came on board like about 5 years ago at SWOPE and started making connections and friendships with the team at Children's Mercy and all that. And so they they had this project in their hands, and they're like, well, we have Priscilla as a connection, and we have Dr. Thomas as your mom, and like we just made it happen together. And it's been a great experience ever since. Our vision is like that we have the duty to provide culturally competent, which is really challenging sometimes, and age appropriate, which is also challenging, care for obesity treatment for our community. And that's a dream that we are planning to make happen, which will be a new concept of how we treat obesity in our city and communities. So our project will have different phases. Our first phase is from now till January, which will be promoting our program, the name, the marketing tools, the referrals from all our doctors. We have like over 50 providers who are going to be referring, and lots of families who qualify for the program already. And we will establish these systems with our electronic health records. We're going to be developing templates. We got a lot of work to do, but we're really excited. And then in January, we plan to launch our first group of patients and eventually expand and make it better and better every single day. And that is our vision. We hope that you guys can also stay tuned to what's happening about this treatment and look forward to your feedback. Thank you.
Great, thank you so much. So you've heard about the three components. There's obviously a lot going on in those components. As I said at the top, while this is not a research program, we're not intervening and testing a hypothesis, but that doesn't mean that evaluation is not very important to this work, because we do want to figure out what's working, how well it's working, what are the contextual factors that might be associated with success, or if it happens, failure. So we want to understand those things. So we have our own dedicated evaluation team. I mentioned Dr. Vicki Colliacres earlier. She is the principal investigator on her own CDC REACH project, but she also serves as the evaluator for this project. So she's going to share a little bit about how they are doing that. Things go.
Just use the arrows.
Yeah.
Good morning, everyone. As Dr. Shook said, I'm Vicki Colliacres. I'm an associate professor at the University of Kansas Medical Center in the Department of Population Health and lead the evaluation portion of this REACH project. Dr. Shook also referenced a great relationship with CDC that undergirds this project. And that relation shows up in a few key ways, and evaluation is one of them. They are fairly prescriptive about the kinds of performance measures that we have to report on, and our evaluation team leads collection of that. So I wanted to give you a sense of our overarching evaluation questions and approaches, in part because, as you heard from our various speakers, there's a lot of variation in what people are doing. So instead of getting into the weeds, and also with the remaining 5 minutes, I'm just going to give you a broad sense of the things that cut across the three goal areas. So overall, CDC has encouraged us to focus on two overarching evaluation questions. These are: how have communities changed since implementation of the strategies to improve health, healthy eating, physical activity, and healthy family weight? And within that, we are really interested in making sure that we understand what settings have changed and in what ways, what policies and plans have been modified, adopted, or implemented, and how many people have been reached or exposed to those changed policies or plans. The second question of interest is: how have health equity approaches been prioritized in communities? And we're really interested in understanding the ways that equity is centered in the work that is undertaking. In addition, overall, our team has some cross-cutting questions as well. These include: what kinds and amounts of resources are leveraged to support implementation, and what factors are facilitating and constraining implementation, and how are partnerships involved in the work? If I thought it was too early in the morning to start introducing logic models and various frameworks, but if you can geek out for evaluation like I do, I'll just note that the REAIM model, as well as Proctor's framework for implementation research, provide a foundation for our evaluation plan. I also wanted to give you a sense of the cross-cutting approaches that we are using to understand these evaluation questions. Our team uses an implementation log to document the implementation of various activities across the 3 goal areas. When they do that implementation, they're recording things like the kinds of policies or plans or developmental activities that it takes to get to changes in policies and plans. They're recording settings, they're recording places so that we can use GeoID to understand reach of the efforts that we're undertaking. We also will conduct an annual policy and practice review that includes our project leadership as well as community partners in reviewing information about implementation to ensure that we fully document changes in policies and plans, but that we also fully understand the implementation factors that have an impact on how well we do, as well as sustainability of different efforts. And lastly, we will be administering surveys annually to the partners involved in this work to conduct some different partner network analysis, and again, understand the factors that either facilitate or constrain implementation of efforts. We're really excited about the opportunity offered by this project to better understand what it takes to be successful in communities in changing big policies and environments that are the goal of this project. With that, I'll hand it back to Dr. Shook.
Okay, so can I invite everyone who was involved in the project to come on up? You can just stand up along the front here. You heard a lot of information on a lot of different topics. Are there any questions either in the room or online?
Got a question. Yeah, so
yes.
Each of these different programs and initiatives, are these all at least partially funded through the REACH award that was mentioned at the beginning?
Yes, so the question for those online is, are all of these things that we talked about, is that all funded through the REACH initiative? And I think the short answer is yes. The longer answer is sort of, because one thing you'll notice, and I think most of the people in the room know the people standing up here and the work that they've been doing for years and years and years. You know that these often are not necessarily new things that are being started just for this project. There are some things that are brand new, but it's a lot of things that may be a different way of approaching something that they've been doing for a while. So there has been some new funding that we're giving to each component, but then there's also funds that are being leveraged from either past work or ongoing work. And you heard Dr. Kali Akers mention that. That's one of the things that we're evaluating is leveraged funds in this work.
Thank you.
Great question.
Question for Dr. LaRush. With the Family Healthy Weight program, what does that look like, operationalized or like facilitation? Is that something that's taking place in-house, or are you meeting people in the community to, facilitate this program?
We are actually doing it online. It's actually virtual. So it's done, this particular version of the program is done virtually so that they can literally chime in from their home on their phone or on their computer, such so that because we found that's easier for families because, transporting and childcare and all that stuff, getting families to that location can be challenging. As much fun as we have with them in person and as much as the kids like in person, this version we found can reach a little more people.
Have you found that folks are typically pretty well engaged and receptive to wanting to participate in that program?
It depends on the family. Some families are in a place where they're ready for a program like that. Some families are not. But once they get involved, I've sat in I did a couple focus groups already, and they really love, the ones that get involved really love it. So. Okay,
you mentioned 26 contact hours. Over what span of time? What does that look like?
Yeah, so it is currently a 12 weeks of group, and then some individual sessions, some of which start before the group and some which continue after, and then some of which are kind of sprinkled in between. The group sessions are about 90 minutes, so that accounts for some of those 26 hours. 26 hours is the ideal. It's the thing that's in the guidelines. Do we always get to 26 hours? No, not necessarily.
Okay, thank you. My last question is this open to, anybody in the community or specific for the patients who are coming through? I forget who you're with, but is it specific to those patients or open to whoever wants to participate?
Currently it is going through Children's or it's going through SWOPE, and so our referrals are coming through that. But whether we can open it up, I think that's open to possibility. Thanks.
Great, excellent questions. I think we had one online from Krista. And Krista, if you'd like, you can unmute yourself and ask the question yourself.
Sure. There was a specific policy that was mentioned during the bike walk KC portion, and I was just wondering if that could be repeated. I didn't have time to jot it down.
Let's see. I mentioned the updating the city's walkability plan. I mentioned the Vision Zero policy, which is reducing traffic crashes and fatalities.
I think it was the zero fare transit policy.
Oh, zero fare transit. So Kansas City is the first and largest city to make buses free for the majority of bus routes. They call it zero fare transit. You no longer have to pay a fare to use the bus. That was originally a 5-year funding plan, which is expiring this year. And so there is a lot of conversation at City Hall and around the region about what happens next with the zero fare transit policy. Hopefully that answers the question.
Thank you.
Great. Other questions? So great.
I had a question for Eric and for Raquel. With the youth-facing programs that y'all are doing right now, do you have capacity currently to expand that to more locations to serve more children?
Yeah, so we actually have a program summary that we can send you of the different ones that are specifically for youth. But yeah, we assess throughout the year. It could either be summer programs or during the school year. So yeah, we have capacity for youth programs. Who's the other? Yeah, okay.
Yeah, for school-based programs, we do have capacity. We're pretty much booked for this current school semester, but spring semester will be scheduling soon. And so if there are schools that you know of that might benefit from programming, we'd love to talk to you.
Thank you.
What other questions might you have?
I want to comment. Something one of you said just kind of sparked a little energy inside of me. I think that we all need to be sharing out the good news of what's happening amongst ourselves and amongst the groups and amongst our networks. There's so much negative out there. The positive is so encouraging. And the number of people that you guys are impacting, and the number of individuals and families that are benefiting from the work that you guys are doing needs to be shouted loud. So that's maybe a message for all of us that we can talk about later, but we should be sharing our successes more. So.
Yeah, great. For those online, I don't know if you could hear the comment. It was a comment about this work is very important and we're doing a lot of great things. All of us are doing great things and we need to communicate that with others. And I would just say, there are several ways that we can help with that. We do a monthly newsletter our next one is coming out on Monday, Katie? On October 2nd. Thank you, Katie. And we absolutely love to showcase what our partners are doing in that monthly newsletter. It goes out to over 1,000 people. So please, if you would like to have things you want to include in that newsletter, please let us know. We also have social media channels where we, again, love to report out what partners are doing. And we are always looking for partners to spotlight that are doing great work. So had another question from Allison.
Hi, healthy bus of the food.
The Healthy Harvest Mobile Market, yeah.
Did you guys grow the food at the community garden, or how did you guys get
I wish. We partner with local growers, so CNC Produce is our main provider, and we have it delivered fresh every single morning. Janet actually calls in tailor makes every delivery depending on what community we're going in. So if it's a Hispanic community, she redoes the whole order. If it's an African-American community, she redoes the whole order. If it's kids, if it's our homeless population, every day we're having to tailor make it. But CNC Produce is where we get most of it.
Can we bring the bus to events?
So we could actually bring the bus. What organizations do is they buy out the bus. They tell us how much grant funding they have, how many bags. We bring everything ready to go in the bags, and then we can bring the bus and then we give off of the bus. But people can't really come on anymore since COVID, but we can bring them out.
Damn it, COVID.
I know. Janet still wears her mask. Look, she's scared.
And Janet, raise your hand. Everybody knows Janet. Janet should be up here, but she's too shy.
Yeah, Janet.
Janet is. Yeah. Yes, another question.
That produce locally from farmers.
I believe it's a legal issue.
Did you say?
It was
I'm
source,
sorry, what was the question?
sourcing it from actual farm.
Oh, yeah,
Yeah,
they,
the legal thing.
yeah, due to the liability, University Health, they won't allow us to go,
Yeah.
where farmers can just come and donate it. We have to get it from a vendor.
Yeah, we can't even do tastings or food preparation, anything like that because of policy stuff.
Could you go through the Kansas City Food Hub?
Could we go through?
Could you buy it from the Kansas City Food Hub, who then is buying?
So we're actually, that's one, something new now that we're kind of exploring. We just went there and did a tour a couple months ago. And so that's one of the things that we're exploring right now.
That would be fabulous.
Yeah.
Absolutely.
Because they would do that work.
Yeah,
Get
they
it to-
would,
They would get
absolutely.
it to the point where it meets the standards that you're looking
Oh,
for.
yeah.
Absolutely. Rightfully so.
Yes,
But then it would be
Yeah.
beneficial for those farmers as well.
absolutely.
And whenever we have
Collaboration.
I was gonna say, it sounds like a policy environment or systems change.
And we have a lot of local, we purchase a lot of local through the vendor as well. So
CNC is
we-
fabulous for that.
Yeah, we have, I mean, whatever is in season in the Missouri area, we always go for the local, like now it's apples. And so we're purchasing only Missouri apples. Yeah, so always trying to support our farmers, definitely local, but just in general as well. And since I'm talking, I'll just say this.
I knew you couldn't help yourself.
Can you give her the mic?
It's a CDC rant. CDC reached, it took me a long time when we were engaged to really understand, like, what are we doing? Because they were saying we can't use this to purchase produce, but we can use it for other things. And so there were so many different organizations and groups involved. And I'm like, okay, so what are we doing again? How are we doing this? And so it began to come together for me mentally. To understand. And so I think one great example that has really enhanced what we do with the Healthy Harvest Mobile Market, with Food Pharmacy Initiative is at the end of the day, we have to donate a lot of produce. Whatever we don't use, we donate it. Is it helping others? Yeah, it's still helping others, but it's not really helping us in terms of cost, being cost effective, right? Well, as a result of being a part of the CDC REACH grant, the collaboration, we were able to receive a really large cooler. So no, they couldn't pay for the produce, but they can really help enhance the services that you're already providing, which really for me is like we're just super, super happy now because some of that produce that we would have been having to donate, we have a cooler now and we can make sure that it's stored at least for just, with 24 hours, no longer than that, but we can get it out instead of doing it. So I'm just really happy to be a part of such a huge collaborative effort in terms of strengthening. How often do you get to strengthen what's already there? So anyway, thank you guys.
Now that you have a microphone.
Yes.
mentioned for the
Mobile market.
mobile market. So you were mentioning how foods were tailored to the community based on their needs. How was that? Is that based on self-report?
Yeah, so our department has been in existence for 13, 15 years. So we kind of know what neighborhood and what culture is living in each neighborhood. So that's just a trust factor we have with them. And we do assessments with them. And Janet always asks for that feedback. What did you not like in the bag? What are you not using? What can you not store? And that's how we've learned what the transient population actually can use and eat. But it's just from years of experience and then the surveys and doing assessments with them for every program we do. And just really quick to add on, over the 15 years at our department, the only way we can get people to come out to all of our programming is those bags of produce. And we've learned that over the years. For that bag of produce, they'll come to anything you have. And so that's where we realized food insecurity was our biggest issue over the years, because they would come to even some of the most boring topics for that bag. So it's such a big deal.
With your food pharmacy initiative, with community health workers going into people's homes.
Yes.
Is there specific programming that you follow for that, or was it individualized for their?
So it took us months. We developed it in-house of just, again, experience over the last decade or more of what we feel they didn't understand. And we just broke it down into really, really specific topics. Everything is done in 3rd grade reading levels, Spanish and English. And so we just did, it's a whole year, so it's a lot of education. The binder's pretty big, but we tried to make the education so visually pleasing that they would take it out of the binder and share it and put it on their fridge. And so we just, over the years, listened to the different topics. Like over the years, we learned they don't want to learn about physical activity. We've had to take that out of a lot of our programming because they throw it away or they don't care about it. But we have learned that a lot of them wanted to learn more about specific oh my God, we tell you all the time that personal trainers want to make us do macros and micros. They like to learn more about that stuff. And we were like, what? Shocked, just shocked. And specifically about protein. And so we are very specific on the education according to what, like I said, every program, even the high school programs, elementary, middle, we do assessments and we ask them, what do you want to learn? And so that's how we've come up with it.
Any final questions? Okay, the last thing I would just say about this work is, as I mentioned, I think all of us know the people up front here. They've been doing this work for 15 years in the community, 20 years in the community, 5 years in the community. And throughout that time, you just establish collaborations and connections with people. And I think that when this funding opportunity came up, it was really, really short notice. But because we had existing relationships between all of us, we were able to very quickly put together an application and get it submitted and get it scored very, very well. And then likewise, once we got funding, we had to start quick and we were able to get a lot of things done. And I think it's through collaboration. And I think that that's really so important that we all work together on these common issues locally. We all should be working collaboratively with our state partners, either in Missouri or Kansas or between states. And I think what I'm really excited about is this project is we are now establishing these collaborations with the Centers for Disease Control and Prevention. So our federal partners, and we're learning a lot from them. Sometimes it seems tedious, but we are learning a lot. So collaboration is really the key. And so please, please, please continue to network with your partners, whether it's through forums like this or through other forums. So with that, you guys have been sitting for a long time. So stand up and give a standing ovation to all of our presenters.
Picture. Oh, all of you move closer, please. And in there too, yeah. Janet, you gonna hop up there too?
Janet, you were hiding this whole.
You look great, Janet.
There you go, much better.
Oh. Thank you so much. Make sure you share those with all of us.
Sure. But you'll figure out which ones are mine.
Okay, we've got a little bit time left in the program, but please, while you're up, get yourself a drink. And we'll go through these last slides and sharing of information.
Is it just you or is there any?
Yeah. So I would say.
I think we'll have space. Yeah. So I could just see it. Makes the most sense to We'll figure it out. Makes sense to. Where it's at. Okay, no. Yeah. But yeah, I think we should have this. Okay. Whoever draws the short straw by at the very back. No problem. Oh, it's the. How old now? Oh my gosh. No, it's not. Congratulations. Okay. I too. She's 2 there. But yeah, so not that far. But yeah, she makes sure I want to do it. I want to do everything. Yeah. I think it's just like yes. Now that I'm old enough to I get it. Like you're figuring out how to do that.
All right, we've got just a handful more slides. So we'll go through these and let you resume your great networking. So as you know, the Kansas City Physical Activity Plan is one of our largest initiatives. And we have regular ongoing sector meetings. You can see the ones for schools, public health, infrastructure, parks and rec, and business and industry posted on here. You can find also all these on our website. So I won't go over them more here. Excuse me. We have some specific meetings, exciting things happening in our healthcare sector. Did you want to go over these, Katie, or you just want me to share? Sure. Okay. The healthcare sector has several specific things that they're working on. One is around curriculum within medical schools and other schools of nursing, schools of professional education. That meeting, it meets on October 1st. We have a Just Walk meeting. That meeting is on October 8th. And then the overall sector meets on October 8th as well at 11 a.m. There's a new location for the Just Walk meeting in Missouri, and that is at Hospital Hall Park. That's actually the park right outside Children's Mercy Hospital, if you've ever been up there. And they are walking on Thursdays. Next one is Thursday, October 24th, as you can scan here if you want more information on that. Early Childhood has their next meeting on October 21st at 9 a.m. They just completed a very big training last month. Heard it was big success. And I think that there are some great pictures from this. I don't know, Natalie's not here today, but I don't know, Lori, if you want to say, if anyone else wanted to say anything other than it was a great and successful meeting.
I think that's all we can say about it. It was fabulously attended. Everyone had great things. Nobody left there without a door prize. Like everybody was happy. So
yeah, great. Kudos to all those involved in planning for it. I know it was a lot of work and several months of planning. So congratulations on that.
The thing at JUCO, the 7th?
no, it was out at the Johnson County Arts and
Oh,
Heritage. Yeah, and I will say, because you mentioned our next sector meeting, we do have a brand new day and time that we're doing that. So if you're going to join us and you were used to coming to the old time, make sure you look at your calendar. That's what it is.
Yes, Katie.
That next slide, that should be a video.
Oh, it should be?
Yeah, it's
Oh,
a
okay.
video. So you can kind of see a little bit about it. Looks like fun, yeah. What is the goal of this video?
So we were cleaning our room, and so I'm using balled up socks, and the goal was just to get them to the other side. So practicing throwing and just physical. All of her games are eliminating, and there's no winner. So after it was done, time was up. We didn't count the socks to see which side won. It was just to keep moving.
That's great. My 3-year-old would love to do that. Oh, okay. Here's more pictures. Look at all these great things. Feel free to, if you want to annotate any of this, Lori.
Oh, so there I am in the upper left-hand corner. So the goal in the upper left-hand corner was to try to hit the pie pans. So everybody from every direction, all doing it at the same time, which one of the really positive things of everybody going at the same time rather than taking your turn. Nobody's watching you when everybody's doing it at the same time. So children who have lower development levels in their physical activity aren't going to be judged, and they're just going to be having fun and doing the same thing as everyone, all at the same time. Right there, obviously on the top middle is our fabulous presenter, Dr. Kraft. On the right, this was, the food program from Johnson County. Oh gosh, sorry, Kelly and Kathy. Daycare Connection food program out of Johnson County went out to one of the providers who had attended the conference, and she was already using some of the prizes that she won at the conference, and the kids were getting active. So that was already a high level success to us using the things. And then down in the bottom one, that is the same activity from that first picture, except now a whole new level of difficulty, because instead of just throwing it over the rope, you're trying to throw it across the river. So as you can see, there's 2 ropes now. So we didn't want anything to land inside the river. And it also made for a variety of skill level, because the guy in the very middle that's holding both ropes, obviously the sides of the river are closer together on that end, and farther down the line, it's farther apart. So it's creating that varied level of difficulty all in the same group. And once again, everybody's going at the same time and everybody's being successful.
Great. That's great. And as you can see, it clearly was a great event. And this is why, one thing that I think I really applaud the group for is really bringing in this national expert on these topics to teach us locally about how we can improve our policies. So great job. Like I said, I know it was a lot of work. Congratulations to all of you for pulling it off. Okay. On your table are copies of the State of Play Kansas City report. This is the report that was released last week. It is the culmination of about 2 years of work from the sports sector. We have both of our sports sector leads here right now, Bill Brandmeier and Pete Piscatello. Go ahead, wave your this. Many of you attended the summit that we held in April at the same location as where our early childhood event was, Johnson County Arts and Heritage Center. There was a lot of activities that were completed outside before and after that summit, including an 4,100 person online youth survey that was completed. Lots and lots of key informant interviews that you see reflected in that report. And some of the key findings that we found is that only about 24% of boys and 15% of girls surveyed in Kansas City met the recommended amounts of physical activity of 60 minutes per day. So that is below the national averages. That's actually below the state averages as well for Kansas and Missouri. One thing we had been wondering about for the past 4 years, but we didn't have any data on, was the associations between physical activity and mental health. And we found that children who were physically active were twice less likely to feel depressed nearly every day than inactive youth. You'll see additional data in that report on mental health outcomes, both positive and negative mental health outcomes. I think that was really shocking, but again, kind of what we had expected coming out of the pandemic. We also found a kind of a cross-cutting theme throughout the entire report were the barriers to participation. Common barriers are transportation. We heard about transportation earlier today, so that's a big barrier. What you see on the slide here on the right is cost, money. There are vast disparities in team participation rates based on income status. Additionally, you'll see variations of enjoyment based on your income status. So there's a whole host of information additionally in the report. One that's not in here that I just want to point out is the number one reason why kids play sports is to have fun. The number two reason kids play sports is to get scholarship? No, to be with your friends. Getting a scholarship, winning, learning skills, those are much, much further down on the priority list for what kids want. And one thing that I think is just how youth sports is today, it's parent-driven activities. And I think it's one thing that the Aspen Institute really encourages us to use is center the youth sports experience around youth, asking them what exactly they want to do, what they want to do. So there's copies of the report on the table. There are boxes of reports in the back. If you want to take some to your organization, just let us know, or you can just grab them out of the boxes and bags back there. Please take them. We've got a lot of them. So please share this with anyone in your networks. Let's see. Do we have any partner updates that people want to share? Yes, Allison.
We have very exciting news. I'm with Johnson County Park and Recreation District, and we have a few other club teams. We have the Kansas City Blazers swim team, we have the Kansas Kids gymnastics team. We now have a JCPRD kids triathlon team. So this is one of the first of its kind in the area. We're very excited about this. Then also we have a free marketing opportunity coming up for any community partners if they're interested. We're having our big free community event. It's a jamboree. It's an indoor Halloween event, but we just ask partners to sign up And then they can come share about their programs, pass out fun things for kids. It does not have to be candy. It can be toys or other things. Please try and avoid candy if you can. They get too much of that. But if you would like to join us at that event, please come see me. I've got business cards and you can email me and I'll send you all the info. And if you want more information about our kids tribe, let me know and I can send that to you as well. Thanks.
What other updates do people want to share with the group? This is your opportunity. Mr. Brandmeier.
Well, I just can't turn down a microphone. So my name is Bill Brandmeier. The Sherwood Foundation is hosting a Top Golf event on the 13th of October. We're inviting kids to come get free golf lessons from 2 to 5. If anybody's interested in having a group of kids come and share the experience, that get a chance to play golf, we'll have a golf expert in their bay teaching them how to swing the clubs and just making sure they don't kill each other. And we will have afterwards have them out in the parking lot and have a meet and greet and suites with University of Kansas head coach Bill Self and his entire 2024-2025 basketball team. It's free for kids in under-resourced situations. And there's also opportunities for kids to come and be a part of it if their parents can afford to pay to be a part of it. It's called the Blasters Kids Zone. The event's called the Blasters, not the Masters. It's a charity event unlike any other. There'll be a corporate event at night and a celebrity kind of swing party in the middle where we'll have Brian Haney and head coach get up on the mic and talk. But mostly it's about raising money to help kids connect to sports and promote what's happening with this incredible document that you have all had a chance to look at. This Aspen State of Play report has been in 14 other communities throughout the country. And in every single situation, it has just launched an enormous amount of effort into doing the right things for kids and connecting kids to the right kinds of activities that get them off their phones and get them into physical activity. And that's what's so important. So I could go on, but
What's the date again for that?
October 13th. It's called the Blasters. And they'll be in the newsletter. If you open the newsletter, which you should, there'll be something in there about it. There'll be links. I'd also encourage you all to invite other people to join the mailing list because having 1,000 people on this mailing list is ridiculous. The amount of good energy and good stuff inside what the collaborative is doing needs to be promoted to more than 1,000 people in Kansas City. Right, Robin?
Absolutely. Bill is our hype man. I love it. Okay. Any, yes.
Yeah, Ian Eric with Bike Walk KC. Another physical activity update. October 9th is International Walk to School Day. That's October 9th. So we're encouraging local elementary and other schools to organize events to get kids walking to school on that day. There's already several signed up around the region from Shawnee Mission, North Kansas City, KCPS, KCK. And there are toolkits available to help advocate for your school to participate, also playbooks to help them kind of plan an event. So if you're interested in that, we can connect you to resources and get kids walking to school on October 9th. Thank you.
That's great. Do we have anything on our website or is like we had in the past? We didn't.
Is that toolkit on the Bike Walk KC site?
I would say just Google Walk to School Day 2024 and you'll find all of those resources. But feel free to contact us as well if you have specific questions locally.
Right. Other updates, announcements. Any online, Kelly? Okay. Then I want to I'm going to make our announcement for our December quarterly meeting. We tentatively have it scheduled for December 12th. We just can't book the room until like next week or something like that. So we will 99% positive we will be having it on December 12th unless Kaufman's having something very big on that day. But that's the plan. And we have a special speaker, Dr. Chelsea Cratch, and she's here in the car. Now I'm going to put you on the spot. Do you want to give the crowd a preview of what you're going to be discussing?
Well, it is right there, 24-hour movement behaviors. I'll also update to be a little bit across the age range, but I just want to say thank you again, President. This is my first meeting. You guys have been so welcoming, so I'm excited to share a little bit more about my research as I'm new to the Kansas City area. So thank you.
Give us a teaser for what you're going to talk about.
Yeah, I'll be talking about the 24-hour movement guidelines. They were created about 10 years ago and some implications for community projects, both things that you can do within your community organization, but even just opening up, thinking about how we can, as ourselves, think about the 24-hour day and how sleep impacts physical activity, but also physical activity might impact sleep as well. But I'm excited to talk a little bit more about it and share a little bit more of what we've been doing. I've been working in 24-hour movement for about, I want to say almost a decade now. It sounds so old, but about 10 years. So I share my work from 0 all the way to 18.
Yes, I was just going to say the ages, because I know you do a lot of like early childhood, but you go all the way up to 18.
I do, yeah.
Great. So if you want any more information, you can buy her a coffee at the back of the room before you head out.
I think she made me think of something. Did anybody see her nails? They match her watch. So you know, so.
Just my daughter's soccer team,
Okay.
so.
If anybody wants to be a guest on Movement is the Medicine podcast, also they can reach out to me and I'd love to have you on and Mr. Rogers. Yeah. In my neighborhood.
Excellent. Okay.
If you want double up brochures, please take them. We want to get them out to people rather than sitting in my office.
Great. So there's a couple big stacks of double up food buck brochures on that table. There are more state of play reports in the back of the room. There are also a box full of pens in the back of the room as well. So with that, thank you for joining us today. I thought it was a great meeting. Good collaboration. Hopefully you can stick around, continue your conversations. Please fill out the evaluation form. You can scan the QR code right there. We do listen to what you say. We have changed, for example, our breakfast offerings based on comments that people put in there. So we're very receptive to your comments. Thank you so much for joining us and have a great rest of your day.